If you've got the right relationships and you build the right risk model, you can get the resources you need. Not necessarily what you want, but the resources you need to do the job right.
Hello and welcome to Code to Cloud. I'm Tim Chase, Global Field CISO at Lacework, and today I'm excited to talk with Bill Dougherty. Bill is CISO at Omada Health, and he brings with him over 25 years of experience in IT and security at such companies as RagingWire, StubHub, and Copart. Bill, welcome to the show.
Thanks, Tim. It's great to be here.
All right, let's just get straight into it. I don't believe kind of in lead-ins. I want to start talking about HIPAA right off the top, right? One of the most fun things about being in the security industry is dealing with regulations. And obviously, you working for a healthcare organization, you've got some very specific ones that you have to deal with, for example, HIPAA. So, at the CISO at Omada Health, obviously one of your primary challenges is navigating HIPAA. How do you deal with that? Like, what do you and your team do to be able to make sure that you're HIPAA compliant and that you're protecting the data of patients?
Yeah, it's interesting. As a CISO, HIPAA is the bane of my existence, but it's also my best friend. And what I mean by that is that in healthcare, everything is harder than it would be if you're at another organization because you have this overarching set of regulations. At the same time, it's easier to justify investing in security and investing in privacy and investing in controls because you have this overarching set of controls coming from the federal government that says you must do this. So things that were easy at other companies are really hard, but at the same time, things that were hard at other companies, like justifying budget for some things, are actually easier at a healthcare organization because HIPAA gives you the stick, if you will.
That's a really good way of looking at it. I've been talking with several CISOs lately, had a panel yesterday, and I think that really hones in on something that is important when it comes to budgeting, right? So obviously we're all fighting for budget. The security leaders are no exception. Like, I very rarely have I ever heard of a CISO that says, I get what I want, and leaves it at that, right? We're always having to balance and fight for it, right? And then you're doing that sometimes with a board that may not be security focused, right? So you find that when you go up to your executives or you go up to your board, being able to say things like, look, we've got to comply to HIPAA. In order to comply to HIPAA, like, we've got to enforce it, all of this encryption here. We have to be monitoring, at the intrusion detection level. Like, it kind of gives you that way of enforcing security and getting budget.
I would say I've never met the CISO that has too much budget. I certainly don't have too much budget. And if my board is listening in, I could absolutely use some more money. But it gives you kind of a baseline where for us, we are protecting millions of records of health information. And if we have a data breach, it is an existential risk to the company. Because foundational, what we do is trust. We have to have the trust of our partners and our customers and our patients, and a data breach would break that trust. So you have to then have a good relationship with your board and with the rest of your executive team, where if I say, I must have this, like, if I don't have this, we're putting the life of the company at risk. You have to build up a trust where you can't just pull that card every time. If you pull that card every time, you're Chicken Little. It's not going to work. But it certainly gives you a framework and a backdrop to say, these are the things that are really important, and these are the things that we must do, and here's why. I was working with our general counsel the last couple of months trying to come up with a more sophisticated financial model where we could actually model out what is our real risk of a data breach on a per record basis. And the answer is it's really, really complicated. It's also really large dollar amounts. This year we will cross having more than 1 million patients in our program. So think of that as 1 million people where we have health information. Now go look at any study on the cost of, or the risk of a record. And let's say it gives you a range, and at the low end of the range, it's $5 or $10 a record. At the high end of the range, it's $500 a record. So $500 a record times 1 million patients is a really large number of a data breach. But that isn't actually our risk because not all records are created equal. I guess it's a long way of saying, if you've got the right relationships and you build the right risk model, you can get the resources you need, not necessarily what you want, but the resources you need to do the job right.
tying it back to business objectives, whether that's, keeping the goodwill, not being fined, but just in general, helping them advance the business, right? They've got 1 million. I'm sure that they would like to have more data because, that's how they grow and they expand, right? And so, tying it to those business objectives is something that I've been hearing a lot about and talking a lot about lately. But one thing I do want to hone in on, because I'm really kind of curious your thoughts. You mentioned that HIPAA is a good start. I think you said it's a framework. Do you find that, you start at HIPAA, but then you have to add more controls on top of HIPAA in order to, protect the data to an even better extent?
Yeah, I think that's fair. HIPAA is a 25-year-old law, and things evolve over time. So certainly, if you just took the security rule of HIPAA and said, "Okay, this is my checklist," you aren't meeting the bare minimums. You might be meeting the bare minimums of HIPAA, but you're not meeting the bare minimums of what you actually have to do to protect your data. So what we've done is, over the years, we've put together our control framework, and it's based on some standards. It's based on NIST, and it's based on SOC 2, and it's based on high trust, and it's based on the security rule of HIPAA. And then we layer onto that also obligations we've made to other customers. So we sell to the largest employers and the largest insurance companies in the country. And when you do that, they have lots of opinions as to what your security ought to be as well. And so we make contractual commitments. And when we do that, that then becomes a new set of controls that have to go into our bucket and into our framework.
One of the things that I've seen lately is that Florida is introducing new regulations that prohibit providers from storing data offshore. What's your kind of interpretation with what they're doing, and what do you think the implications of that are?
Yeah, I think if I remember correctly, it's SB 264 is the new Florida law. And what they did is they've imposed new obligations on healthcare providers using certified EHRs, certified electronic health record systems, to store only in the United States. But it actually goes a little bit farther. When you read into it, it covers storage, processing, and accessing of health information. The general idea there is they don't want health information offshored. Now there's two good things for us. One is we aren't using a certified EHR. So even though we have Florida patients, it's not really clear that the law applies to us. The second is we have always operated in the U.S., where we store and process exclusively in the U.S. We commit to our customer contracts. The sticking point really is going to be the definition of access. If you think about it, like, we are a cloud native company, so we have lots of SaaS providers. We run all of our infrastructure in Amazon. The large SaaS providers in Amazon, they have global support organizations. And there is a scenario where one of my SaaS providers that has electronic health records in it could have a support organization in Australia or in India. And if I contact them for support in the middle of the night, are they accessing health information from offshore? It's a harder problem to solve. And so we're looking at it, A, trying to figure out exactly what is meant by access. B, does it apply to the systems that we're talking about, or does it only apply to a certified EHR? And then C, what do we do about it? Spirit of it is good, which is we should keep U.S. health information inside the U.S., and that's how most health providers operate today. But the details of it become really tricky. And it's always at the edge cases. The edge cases for security are really hard to write into law.
That's tricky, right? Every time I feel like we try and do something here when it comes to the law and cybersecurity, there's always still a matter of catch up. Like we talked about HIPAA earlier, where, it may say encrypt, but it doesn't say how to encrypt or what level of encryption, because it's kind of ambiguous. But like, when you talk about this Florida healthcare law, it's like one of those things that it almost has to get out there, have the critique and feedback, first or second round, and then, do it. Like you said, it's not really new to me. Like I I ran a testing organization for a healthcare company 12, 15 years ago, I think, something like that. And that was a rule that we had then. Obviously, there's no regulation around it. It was just, this is what's done. We don't take this data offshore. Like it's always here. Like, so it's not particularly new. And I would be surprised if a lot of, organizations like yours do it as a practice. The one thing that's still a little bit interesting to me, at least is the way that I interpret it, but you can tell me differently, is it can't be stored there. But what about the access? So what if you have an offshore provider, in Eastern Europe or in Asia that just connect in through, a zero trust or VPN or something like that? I don't think it prevents anything like that. And does that kind of halfway negate the security risk?
Well, I think that's where there's a difference between how we think about security risk and how we think compliance with the law. So, and I am far from an expert on the details of Florida's law, and I've got great privacy attorneys that help me with these things. But I think the risk of accessing data from offshore, if you have the right controls in place, is relatively low. We still try to prevent it. But the law may not account for any nuance. The law may just say you can't access it. And so you then have to go, exactly what do you mean by the term access? Does reading it on a screen mean access? Does downloading it to my computer mean access? Does printing it mean access? There's lots of different use cases, and we have to know exactly which ones are allowed and which ones aren't in order to comply.
And how do you define offshore? That was the thing that always bugged me a little bit. Like I would see contracts that would say, or laws that you can't do anything offshore. Well, does that mean that, are you trying, does it say anything outside of the US? What about Canada, Mexico? Like how do you define offshore exactly?
So that is a great question. In our contracts, we usually specify within the United States.
There you go.
Now then, sometimes it says the 50 United States. Does that include or exclude Washington, D.C.? Sometimes it says the United States, but it doesn't. And sometimes it says United States and territories. So we have a provision where we don't allow employees to take a company laptop outside the U.S. Mm-hmm. Can they take a laptop to Puerto Rico or the U.S. Virgin Islands? Yeah. Or can they take a laptop to Alaska if their flight to Alaska actually lands in Canada on the way?
That's the one that I was thinking of.
It's always the edge cases that get you. And so we try to write policies and put in controls and do all kinds of things to deal with the nominal case and the edge cases, but it's always the edge cases that keep me up at night.
It's kind of the hacker in all of us, right? Even the ones that aren't hackers, like, I could never be a hacker. That just wasn't the way my mind was built, but like, it's the way you want to game the system a little bit, right? And figure out how to game it. Like that's the security in all of us a little bit, I think. Speaking of which, gaming the system and kind of planning that out, one of the things that I want to talk to you about is threat modeling, because I think that's an area that you have a lot of experience in, you put a lot of effort in. So before we kind of go into your threat model and that you and your team developed, I'd like to talk about, like, just for people who may not know, like, what is a threat model inside of the cybersecurity space?
Yeah, so generally speaking, a threat model is a systematic way of trying to identify what can go wrong with the system ahead of time, and then tailoring your controls around it. A lot of work was developed on this from Microsoft several years ago.
Stride?
If anyone, the Stride model, there is a fantastic book by a guy named Adam Shostak that anybody who's interested in threat modeling, read that book. It is the Bible. He's brilliant on it. And they were really focusing on the biggest kind of commonplace risks in software development, and how do we prevent those? So things like we want our software to be available. So so the D in Stride stands for denial of service. What do we need to do in our code or in our system design to prevent denial of service, so that we have this goal of availability achievable? So it's been around for a lot of years, and one of the goals of using threat modeling is to do it early, and the other is to make it repeatable. So you want to be able to have, across a large group of people, the same general answers to come out every time you do it, if that makes sense. So it's a systematic way of identifying risks. versus just getting into a room with a whiteboard and throwing stuff at a wall and see what sticks.
Yeah. I think the repeatable part is something I've always honed in on in my cyber career. Like when I'm starting a cloud security team or an application security team, whatever you do in the process you roll out has to be repeatable. It can't be something that you and you alone can do, and you can only hit play once, and then you're not going to get the same thing every time. I think that even goes back to my testing days when I was running like performance tests and automation tests. Like, right, it's got to be 100% repeatable. So I agree with that. But you also mentioned that it has to be integrated into the life cycle. Like, how do you integrate threat modeling into the life cycle? Like, where would you put it? Is it the beginning, the end? Is it part of like the continuous improvement cycle of DevOps?
All of the above. So I think of it when you're doing it right, you're doing it at the design phase of a project, and then you are coming back to it as the project progresses. So let's say you're designing a new application, and the application is going to have sensitive data in it. So we know we need an authentication mechanism, and we're going to write down at the very beginning what we think the authentication mechanism ought to be. And is it single factor or multi-factor? Okay, great. Now we've got that written down. Now we start going and writing code, and 3 months in, we change our mind as to what the authentication mechanism is going to be. All right, let's go back to the threat model and see what impact that has. And are we making things better or worse? What are the compensating controls? Let's update the model. And then you get into testing or you get into production, you have something to validate against this. Oh, at the very beginning in our design, we said we were using multi-factor. Now it's live in production, and I can get in without multi-factor. What changed? So it's a way of analyzing a system, and you can look at it like if you have a system in place already, you can go do a threat model on it and use that to assess the risk of the system. But ideally, you're doing it at the very, very beginning.
Yeah.
We also use it for our vendors. Every time we're going to bring on a new vendor, we do a threat model on them. So because we need to figure out how that vendor is going to fit into our ecosystem. So a good threat model can be inserted at all various stages of the life cycle.
Yeah, it seems like there's a little bit of parallel, I think, like the way that I do static testing sometimes. Like it's not always like you run a fresh static scan every single time. Sometimes it's you run it on the diff, like what has changed, like and you just run it based on that, right? Like because that's the way I think to scale to some extent. Like at the very beginning, or maybe at the beginning of every release, or something along those lines. Like maybe you'll run a fresh one just to make sure that you have a complete understanding, you haven't missed anything. But it's one of, and it comes at the end. Like I'm a big fan of the continuous improvement. So some people think it's very much linear, and then you're done with the development of what you're building, right? But at the end, you should be doing a lessons learned, a continuous improvement, and that threat model I think should be kind of in that in there as well.
Yeah, your static testing model example that fits really well with kind of how we use threat modeling, because part of it is we have a baseline set of controls, and so we can go through a system and very quickly say, is this going to adhere to the baseline set of controls? If so, check the box and move on. So using authentication as an example, we bring in lots of SaaS products. Do they integrate with our single sign-on tool? Yes or no? If they do, then I automatically pick up all kinds of stuff. I pick up multi-factor. I pick up device certifications. I pick up, role-based access, lots of stuff. If they don't, now I need to go deeper and say, okay, since you can't adhere to my single sign-on thing, what are you doing? How are we managing factors? Who's managing passwords? How do we provision? How do we deprovision? All this stuff that is built into my framework of base controls that if you just said yes, we get to move on. So it's a way for us to identify the path of least resistance also. Like you can evaluate 3 vendors and one of them adheres to all your controls and one of them is a unique unicorn. Go with the one that adheres to all your controls. Your life will be easier.
100%. But continuing along with the threat model talk, you developed one yourself called includes no dirt, right? And so you win for better name than Stride. So maybe just talk about like where in the world did that name come from, right? And then what does it do? Like, how is it different from like Stride or some of the other ones that maybe we're familiar with?
Yeah. So I take no credit for the name. My head of compliance and we co-wrote the paper on this. What we were trying to figure out is we knew we wanted to insert threat modeling into our process, but as you can imagine, I was very focused on security and he was very focused on compliance. And we also have our privacy officer is very focused on privacy. And there was no kind of one overarching model that encompasses that triad of security, compliance, and privacy. We had Stride for security. There's something on the privacy. I think it's called Lindum. There wasn't a great one for compliance. And so we said, well, gee, let's write our own. And so we put together a list of the, risk categories. And then he started playing with the first letter of all of them because Stride is just an acronym. Well, so is ours. And so we reordered things until he came up with includes no dirt, which governs security and privacy and compliance, has a cool acronym. And then, it also has the advantage of like, well, if we've ticked off the whole threat model, then our system is dirt free, like, or we're reducing the dirt in it. So it's got
works both ways.
It works both ways. Exactly. So like in the Stride model, the S stands for spoofing, and it stands for spoofing and includes no dirt too. But we had includes no dirt for us includes identifiability. For every risk, there's a goal also. So for spoofing, your goal is authentication. For identifiability, your goal is anonymity. So if you